I was saying it's easy to say let people move to the community, but if everyone all at once left institutions for the community, would we have enough affordable housing options for people with disabilities? Are there other pieces of the puzzle that we need to fit in here to ensure that we have a smooth transition?
You know, I would love it if everyone could do it all at one moment and everything was great, but it isn't going to happen like that. It's going to happen in a lot more piecemeal way. And one thing that is a concern to us is that the perfect become the enemy of the good, where we wait for every piece to be in place before we move. But that said, there are other pieces that do need to happen. Housing is a very important piece. We need to have more accessible, affordable, integrated housing. And we have a proposal into HUD that they would set aside some vouchers for people who are moving out to be able to move, you know, into get some funding to help pay for that housing. It's called Access Across America, but they are a little bit dragging their heels on acting on it, even though they got 4,000 new vouchers for people with disabilities in the last budget. And some of that money could be set aside to help people move out.
Right. Ms. Beckett, let's switch roles just for a moment. You know, what should we be doing? Let's switch roles. You are now a member of Congress. You know, what should we be doing? We're switching roles.
Well, I think there are several things that Congress can do. I think looking into expanding the possibilities for individuals with disabilities in communities. I think Stephanie is absolutely right. Housing is a really important aspect of it. Transportation is an important aspect of it. Instead of looking at why these people, or how these people qualify, we ought to be looking at whether we can do more for more people to remain in their communities and at home. That means supporting their families when they're young, supporting young adults so that they can go to work, supporting individuals with disabilities so that they can live in their communities, making that available to them. Katie was denied access to Section 8 housing because she was working on an advisory panel for the Social Security Administration. We totally understood that, but to try to gain access to anything, you've got to meet this level of absolutely no income whatsoever to even participate. That was a county-based program, but I mean, it's very frustrating that everything is so piecemeal that you can't ever put anything together for everybody. I think one of the things that Eileen mentioned was the importance of case management services or care coordination. Having someone who can help you work through the system with you and provide those kinds of services are extremely important. I think having that, getting attendant care is really important. It's a major aspect of this, but you really have to look at the broad-based spectrum of what individuals with disabilities as young adults are facing out there and move every obstacle you possibly can that are barriers to try to get them into the workforce. Working with the private sector to talk about the importance of their ability to work and their willingness to work. I think overcoming some of those barriers, a lot of times it's people don't know how to deal with that. And Katie's been very lucky in the fact that she is in her own apartment. She lives in a building downtown. It's not ideal per se, except it's close to public transportation. It's close to the public library. It's where she's going to volunteer. Getting her a job has been extremely difficult because she has been serving on this advisory panel, but now that's finished, and so we're facing where her next steps will be. Why is it so complicated, and why is it so difficult? It's time to partner with the private sector. Public government needs to work with the private sector to come up with ways of helping individuals with disabilities succeed in their community, and work is a natural aspect to that. But if you restrict school-based funding, if you restrict rehabilitation services, they're not going to be able to do that. And that just is wrong. And special education is the precursor to work. It should be. It should be what gets people ready to go. And those kinds of services are absolutely necessary. Medicaid should not be restricting reimbursement for those kinds of things.
Thank you. Thank you. Thank you very much.